Thanks for joining me. I'm Dr. Ginger Garner, and I'm here to help you have happier hips. And the first way to do that is for me to teach you something called the nap meditation. You can do this breath anytime. It's very practical. If you feel stress coming on, if you want to change your stress response, if you just want to get your day going well, or if you're doing something like overcoming asthma or COPD, etc. This breath is good for everybody. Couple of pointers. One, without trying to change anything, I just want you to listen to what your body, your tissues are trying to tell you. That means oftentimes using touch. That's first. Second, feel. ID tension that doesn't respond to your suggestions, to your commands, right? When I'm talking, for one, as I'm talking to you now, I should not see muscles, okay? Kind of rubber band string type tension, right? Like a violin string. Oftentimes when people talk, you'll see muscles sticking out, jumping in the neck. We want to avoid that because it creates tension here. If we have tension here, we have tension everywhere. So let's get started. The nap meditation is really easy, okay? When you're feeling stressed, when you need to pick me up, when you need to focus, when you need to relax, take a nap, all right? Get comfortable, that's number one. We don't want to challenge yourself. If this is a challenging seated position, forget about it. Don't worry about it, it's not necessary. Lie down, sit in a comfortable chair. You can do this breath anywhere. All right, on to the nap meditation. Nap is something that I came up with that represents three things. The three major diaphragms in the body. Here in the throat, here in the respiratory diaphragm, and here in the pelvic diaphragm. N stands for neutral larynx. A stands for apposition of the diaphragm. The diaphragm is a dome. It should be optimally aligned or shaped. Anything other than that, if the diaphragm flattens, then it cannot descend as much, and that affects breathing, and breathing affects every system of the body and all of your health outcomes. That's why for happy hips, we start here with breathing. And the P stands for the pelvic diaphragm, being able to release it and use it when necessary. So we're breathing, we're listening, we're feeling. We're going to identify any tension that doesn't respond to our commands to relax or be at ease. From your comfortable position, one hand on the throat, we start here. Tension in the throat can determine tension throughout the entire body, not just the other diaphragm systems. Beginning with an exhale. Notice how the skin of the fingers feels against the skin of the throat. If you try to move the skin of the throat, is it pliable? Does it restrict the breath? Okay, as I'm touching my own throat, it does not, as I move the skin, it does not change the quality of my voice. It does not change my breath. And even if I lightly move the larynx side to side, it doesn't change anything. Before we even make sound, we determine this. Is this neutral? Is this at ease? You can come up under the throat, through the neck, bringing the fingers over the collarbones, maybe shrug the shoulders up, and then sink them down. Do the fingers, okay? Meet pliable tissue, or is it hard? Sometimes some body work, manual therapy, seeing your physio or physical therapist or a massage therapist can help with that. There are many, many variables that I usually treat to help us to relax, but we're just getting into the superficial assessment of them, okay? So around to the scalenes and the upper traps, the front of the throat. As you breathe, try to work your way into having a more pliable throat, one that moves, one that allows you to sing if you wanted to. Now, next come down to the chest, maybe one hand at the chest, one hand here near the diaphragm. The breath here is an abdomino-diaphragmatic one. Now, don't get caught up in all the terminology, that doesn't matter. What matters is that it's a belly breath. As you breathe, if my hands are my ribs expand, my belly expands. Not just front to back, side to side, as well as front to back. So as you inhale, if my fingers are ribs, they expand. The diaphragm drops. And as you exhale, everything returns to resting state. Let's try that. Bring your hands down to the bottom of your rib cage. The tissue right under the rib cage should be pliable, and in many, many cases with hips, especially troubled hips, it isn't. This is your first red flag, really good information to take to your physical therapist or into a yoga class. Hands come up right here. Now you're not pressing into the liver and the stomach, okay? We're not massaging those. I want you to press up and towards the screen here. As I inhale, do you see how my fingers, the diaphragm presses my fingers out? And as I exhale, I can get more easily up into the diaphragm area. Notice I can still talk, I can still sing, right? Again, we exhale, fingers go a little deeper. Inhale. Do you see how my fingers can expand and drop a little? As the belly expands and the diaphragm presses my fingers away. Exhale. Tissue releases. Inhale like a metronome. 2, 3, 4. Ribcage expands. Exhale. Fingers may go a little deeper. Inhale, expansion. You may even help with this expansion a little with the ribcage. And exhale. 2, 3, 4. Inhale, the fingers may draw the ribcage out. Expand. Belly expands, drops. Exhale. Fingers may work on making the tissue a little bit more pliable, even if you have to belly dance a little, right? Let's try 3 more. Inhale. Check in with the throat. Move the throat. And exhale. Pliable tissue. 2 more. Inhale. Pliable throat. Neck. Even into the tongue. And exhale. Things go back to resting state. 1 more time. Inhale. 4 and exhale. 3, 4. Notice the metronome. Let's just do it 1 more time. 2, 3, 4, like a metronome. Exhale. 2, 3, 4. Let's keep going. Inhale. 2, just like you're directing music. 4 and exhale. 2, 3, 4. Inhale. 2, 3, 4 and exhale. 2, 3. Good job. Now you'll notice I was counting a little slower than the second hand on a clock because I want us to work towards a 6-count breath, ideally an inhale that lasts about 6 seconds, and exhale that lasts 12 seconds. The breath lasts 12 seconds overall. That gives us about 4 to 5 breaths per minute. That's what we're shooting for in a range, okay, between 3 and 6 breaths per minute. That has some more complex science behind it, but we don't need to worry about that right now. What we are focusing on is this abdominodiaphragmatic breath. But there's one more part of nap, right? Neutral, ideally aligned, okay, apposition. Pelvic diaphragm release. 1, 2, 3. As we inhale, the throat stays at ease, both diaphragms drop. And as we exhale, they come back up. Inhale, and exhale. That's the action. Not sure what the pelvic diaphragm may feel like? Then you can change your position. You could go into legs out to the side. You could sit on a little towel roll. Sometimes I even have people sit on their hand. Here you can definitely feel the pelvic floor. You can roll the pelvis forward, roll the pelvis back. You can swim the pelvis. All of these things are elements that I have people in class and my patients practice because they should be pain-free. And if something comes up in them, then I assess and evaluate and I dig deeper down into other layers and we figure out what it is that's going on. So as we swim the pelvis around, either here, lying down, sitting in a chair, or in our Sukhasana position, or easy seated pose, I should be able to feel the pelvic diaphragm. Now together, let's practice 3 more breaths, and then I will sign off and allow you to continue to practice. One thing that I want to emphasize is this breath is accessible any time of the day. You don't need to do a 10-minute practice. You can do a 2-minute practice and have it be effective, which is great news. Take the breath, take the practice when you need it. Morning, noon, night, high stress, low stress, whatever you're perceiving is happening in your life. It's effective and it works. And it will allow you to go to the next level, which is working on what I call a power breath. Okay? That's an easy way of saying TATD breath, and I'll explain that to you in the next video. But take the breath when you need it. It's probably the A1 most important thing you can do for your health, not to mention your hip health. Okay, let's nap. Beginning on the exhale. I'll walk you through 3 breaths, and then I'll silently sign off and you can continue practicing. Inhaling, 2, 3, 4, and exhaling, 2, 3, 4. Inhaling, maybe hand at the throat, and exhaling, working on ease of the tissues and transition in the breath. Continue 1 more. Feel free to move the hands to any of the diaphragms at this point as you work through your exhale. And maybe 3 more breaths. Should still be moving through your exhale here. 3, 4, and inhale. Continuing on as long as you need to get the desired effect, which is quiet, calm,